Hello, everyone, and welcome to Macquarie's Chiropractic and Physiotherapy Information Evening. My name is Sienna, and I'm a current student here at Macquarie. Before we start, I'd like to acknowledge the First Nations peoples of Australia and elders past, present, and emerging. I'd also like to extend that respect to all Aboriginal and Torres Strait Islander guests in the audience today. As we allow some time for our attendees to join us online, please note that this session is being recorded and will be shared with you after the event. If you do have any questions throughout the session, please put them in the Q&A box at the bottom of your screen. We'll answer them during our live Q&A session later tonight. We have an exciting session ahead of us, and I'm pleased to welcome our speakers for this evening. This includes Dr. Hazel Jenkins, who is the course director of our Master of Chiropractic, Dr. Kelly Gray, who is the course director of our Doctor of Physiotherapy, Heather Jazar, who is a current Master of Chiropractic student, and Timothy DeCroon, who is a current Doctor of Physiotherapy student. Today's program will consist of an overview of our Master of Chiropractic degree, followed by an overview of our Doctor of Physiotherapy. After these presentations, we'll move on to a panel discussion with some of our current students who I just mentioned, followed by a Q&A session where we'll answer all of your questions about both the Master of Chiropractic and Doctor of Physiotherapy. Without further ado, I'll hand over to Hazel, who will start off by providing an overview of our Master of Chiropractic. Welcome, Hazel.
Thank you very much, Sienna. Let me just share my screen. Lovely. So thank you everyone for attending. So I'm Hazel Jenkins. As said, I'm the course director for the Master of Chiropractic here at Macquarie University. I'm a senior lecturer in the department and I'm also a practicing chiropractor. So I'm just going to be giving you an overview of this degree program. So firstly, just wanted to give a little bit of introduction as to what being a chiropractor is all about. So chiropractic is one of the largest primary allied health professions in Australia. And basically, as chiropractors, we assess and treat a wide range of musculoskeletal health conditions. We do have a focus on spinal pain, but we can treat pain or movement dysfunctions throughout the entire body. So to do this, to be able to perform this role and be able to help people with these health conditions, we have a number of different diagnostic tools that we use within clinical practice. So that includes patient interviews, physical examination tools, and also other exams, neurological exams, diagnostic imaging, among others. Within an actual treatment, so once we've looked at the patient, we've assessed them, we've diagnosed what may be the matter, what we can actually address with that particular patient. We have a number of different treatments that we might provide for them. So a lot of chiropractic does revolve around manual therapy type interventions. That's pretty what chiropractors are best known for. And so that includes working on both the joints and the muscles and other soft tissue structures around the body. And that's really how we help to try and make changes within that musculoskeletal system. So that includes joint manipulation and mobilization and a variety of different soft tissue techniques. We also provide a lot of rehabilitation and self-care advice as part of our management of patients. So that includes stretching and strengthening exercise programs, injury management and return to work advice and programs, and also self-care advice to help patients reduce their pain, but really importantly to get them active and also improve their health. So the Master of Chiropractic is a program where we basically are teaching you to be able to do all these things. So at the end of the Master of Chiropractic, you are eligible to be registered as a chiropractor, and then you're able to go out into the community or into chiropractic practice and be able to treat members of the public and be able to run through all these different techniques with them. So in terms of the Master of Chiropractic program itself here at Macquarie University, there's actually two entry pathways. So the first entry pathway is actually if you're coming from the Bachelor of Chiropractic Science, which is a degree that's offered at Macquarie University. As per its name, it has a number of chiropractic related subjects incorporated into that degree. So if you're within the Bachelor of Chiropractic Science, you actually come into the Master of Chiropractic and you go straight into a 2-year program. Effectively, you don't have to do the first year because you've already covered that material within the bachelor degree. The other pathway of entry is to come in from a different bachelor degree, and that needs to be in some related health science discipline. So these are often, science degrees, exercise science degrees, health science, clinical medicine, these sorts of things will come in, and then they'll come into the Master of Chiropractic into our full 3-year program. So that first year covers, as I said, the chiropractic subjects that are also offered in the Bachelor of Chiropractic degree, and then you do the same final 2 years. So the entry requirements for the Master of Chiropractic when you're coming in from a bachelor degree in a health science discipline are a weighted average mark of at least 50 and at least 1 unit of anatomy and 1 unit of physiology within that degree program. As I mentioned before, you must complete the Master of Chiropractic to be registered to practice as a chiropractor in clinical practice. So within the Master of Chiropractic, within either the 2 or the 3-year program, we have a number of units that basically fall into 3 different streams that we teach. So these include units related to clinical science, clinical research, and then professional practice. So the clinical science units form up the bulk of the program. This is a lot of what you'll cover in the first year, definitely, or the first 2 years of the program, so the first and second year. And these include all of your clinical skills. You learn about pathology in the body and how to diagnose different conditions, which is really important for chiropractors. We're what's known as primary contact practitioners in Australia, which means that people can come and see us off the street with basically any condition. So usually people present to us with pain in the musculoskeletal system, but sometimes that pain can be related to conditions that we can't treat and manage. So things like underlying cancer or infection or other conditions like that. So we need to be able to diagnose those and know when it's not appropriate to treat them and know where to refer them. So we have a number of units related to diagnosis throughout the entire body. We cover neurology, orthopedics, diagnostic imaging, rehabilitation and sports medicine, and nutrition and pharmacology, among other units. We then have our clinical research stream that runs through our program. So throughout all of our clinical science units, we speak to evidence-based practice, and we run this research stream throughout a number of our different units. So looking at current research and how that impacts what we're going to do with the patient or impacts the knowledge that we're teaching you. And then in the final year of the program, you undertake a major research project that goes over the full year. Within that project, you'll be designing and potentially carrying out a research project within a group of students. Finally, we have our professional practice stream, and this is where you actually really learn what to do within practice itself. So that includes the legal and ethical requirements, business management, and it also is our clinical internship, which is where in your final year of the program, again, you'll spend a whole year within one of our 3 chiropractic clinics where you'll be working on members of the public while being supervised by trained chiropractors. So coming from the Master of Chiropractic, some of the career opportunities that are available, a lot of our graduates go into clinical practice, and that can either be by themselves or in a multidisciplinary practice. Some people will specialise in certain areas, so sports medicine is a common area that people tend to specialise into. They can also specialise in areas like paediatrics, older adults, chronic diseases. There's a lot of different options there within that clinical practice field. Other people prefer not to go into clinical practice and deal with patients one-on-one every day. Instead, they might be consultants, so in other allied health areas. And a lot of our students can end up in health insurance or medico-legal advising capacities, because of the background knowledge that you have, you can work well into these different areas. And so that can also involve work health and safety and rehabilitation as well. And finally, you might have graduates who want to go more into research. And so we have research pathways that are available after the Master of Chiropractic, and that might include teaching. And this is often done in combination with clinical practice as well. So in terms of our programs, we have a number of facilities which really help us to deliver a high quality program. So these include our purpose-built technique labs, which I've got a picture of here, where we have a lot of audiovisual capabilities to really help with our skills teaching. And then we have a number of other laboratories that are used for the different programs. As I mentioned, there's the clinical placement units, which are conducted in the final year of the chiropractic program. So we have 3 of these clinics on campus here at Macquarie University, and we also have one in Eastwood and one in Summerhill. So these clinics have been up and running for a long time. They're integrated into the community. We get people coming from the community to seek treatment from the chiropractic interns. And as I mentioned, you're supervised by chiropractors there, so you can learn in a really safe environment. We also have a lot of other fieldwork opportunities for students in their final year to also get experience with different elements of the communities. These include sports, geriatric, and other community-based events. So these are just some of the pictures from some of our sports placements that we've done. And our final year Master of Chiropractic students have delivered over 30,000 patient consultations to members of the public over recent years. So finally, as I mentioned there, we do have research opportunities after the Master of Chiropractic, and so that can be a good stepping stone into research if that's more where you want to head. And so we have a number of staff who are very research focused and like to integrate research into our programs and also follow on with research afterwards. And so we've got our Masters of Research and PhD opportunities following the program. And so, yeah, we've got a lot of success in those programs as well. So thank you very much. It was just a very quick overview of the Master of Chiropractic, and I look forward to your questions later.
Fabulous. Thank you so much, Hazel, for that comprehensive degree overview. As she mentioned, if you do have any questions, please feel free to pop them in the chat box and we'll get to them shortly. I'll invite Kelly next to provide an overview of our Doctor of Physiotherapy. Welcome, Kelly.
Hi, thanks. Hi, everybody. It's nice to see you all. I'm just going to also share my screen here. So I'm the course director for the Doctor of Physiotherapy here at Macquarie University. I'm going to talk briefly through what the Doctor of Physiotherapy is, particularly at Macquarie, and what physio is. So let's start with what is a physiotherapist. So physiotherapists assess, diagnose, treat, and educate people across all ages with limitations in movement and function that result from a range of conditions. And if you just have a look at some of the images there, we have some examples there: aged care, we've got pediatrics, we've got sporting, we've got dance. I work in pelvic health, so my job is to, as a clinician, I also treat people who have issues after they've had cancers and well around the pelvis. So we're involved in a variety of different areas. Physios work everywhere from hospitals through to schools, through to workplaces, and through to communities and private practice as well. So there's really quite a variety. And when you want to become a physiotherapist, you essentially get trained in such a way that you could go into any of those areas. You are qualified at the end to work in any of those fields. So why become a physiotherapist? Physiotherapy is currently a profession that is in enormous demand across Australia and internationally. Australian physiotherapists are considered some of the best trained in the world, and I've worked overseas, and every time I go overseas, I'm told, you know, it's wonderful to have physiotherapists from Australia to come and work with us. We currently have more physiotherapy jobs in the country than we do with people graduating, and it's expected that that demand will grow with the ageing population and increase in chronic and complex care. The opportunities are to work with people with all ages, as I said, in a range of settings, but there's also more emergence resulting in leadership and management of healthcare as well. So we're seeing more physios moving into higher areas. The physiotherapy degree at Macquarie University is based what we call around inquiry-based learning. And so you'll see some of the images there are from the teaching spaces within Macquarie University, where not only do you learn the theory, but you then apply that in practice in really state-of-the-art facilities designed to mimic what you will be going out into once you graduate. We also have sessions in our simulation centre that are really designed to simulate some of those really high complex areas such as intensive care units as well. The structure of the Doctor of Physiotherapy is that it's a 3-year full-time extended master's. And so what that means is that the master's degree makes up, that extended master's makes up the 3rd year. So a typical master's is 2 years. As a physio, you can do an undergraduate degree, a standard master's, or a Doctor of Physiotherapy, which is an extended master's. And not too dissimilar to what Hazel just spoke about, there is a research project involved in the last year of the Doctor of Physiotherapy, and that's what qualifies you for that extended Masters. You can see that we have 6 semesters outlined there. We start off with our real foundational physiotherapy skills. Our intake in semester A is mid-year. So our first year's just started in semester 2. We then do managing common conditions. We develop further as clinicians, and you can see we're moving towards the back end as future leaders and independent clinician researchers. And this is what it looks like in a little bit more detail. So you can see there session 2, semester A in that bottom left-hand corner. We're really talking about foundational knowledge. So we do some respiratory physio. We start looking at joint and movement and basic strength training and ethics and safety and quality. And then throughout semester B, we're building on that, and we're looking at spinal, neurology, a bit more respiratory as well, and then evidence-based healthcare. Semester C is really 15 weeks of clinical placement. So you're out in different clinical placements. Some of those are in hospital, some are in private practice, and you do a variety as part of the accreditation requirements of the course. Semester D is about building that complexity. We have pediatrics, you can see workplace and recreation and sports, and we also have chronic and complex care. And then we move into the back of semester E, where we're looking at real complexity in physiotherapy. So we have workshops around things such as intensive care, trauma, spinal, what else have we got? ICU. We have lots of different specialists that come in. And we also do leadership advocacy in business. So we set you up for running a business in the future. And then we've got our research projects and some more placements in that final semester F. There is a huge amount of clinical across the physiotherapy degree, and that's one thing that we're very proud of. It starts in semester A, so within a few weeks you're assigned to volunteer in the community and you're out there starting to integrate straight off, and you do that in semester A and B for 35 hours each before you move into semester C. You can see those big blocks out there on clinical placement. We have sports placements and work health and safety. So one of our students came back recently. He was going to be a sports physio. He spent some time at the Commonwealth Bank headquarters and has decided maybe now he wants to move into work health safety. We have lots of physios who teach into the degree from a variety of areas with enormous expertise, but we also have internships that lead into semester E and F. So internships with, for example, Sydney FC, the Swans, the Swifts. We have some rehabilitation placements, and we do have a virtual international placement as well. So lots of opportunities. If there's something there that you think maybe interests you, physiotherapy might be for you. So the admission requirements, it is a competitive process to get into the Doctor of Physiotherapy. You need to have an Australian level 7 bachelor's qualification or recognised equivalent. You don't have to have come through Macquarie University, and you don't have to have done a particular undergraduate degree in order to come into the Doctor of Physiotherapy. But what we do have are tertiary units in the following areas, and you can see that we've got human anatomy and human physiology and some psychology methods that need to be met in order for you to then qualify into that competitive process. The competitive process, generally you need a GPA of 4.5 out of 7, so that's about a credit average, but some years that goes a bit higher if we get lots of high caliber applications. And there's also an English language requirement with an IELTS of 7 with a minimum of 7 in each band. There are compulsory course requirements that I just want to touch on, and that is that you will have to be part of practical class participation, which can include observation, manual handling, examination and therapy on each other and your peers. There is some disrobing that is required as part of that. The clinical placement requirements are that you are registered with the Australian Physiotherapy Board of Australia. You need to demonstrate compliance with the New South Wales Ministry of Health Policy, and we talk you through that, but some examples include you need to have necessary and ongoing clearances, including working with children checks, police checks, all your vaccinations and current CPR and first aid. And they really need to be done before you start the Doctor of Physiotherapy, so you can start those clinical placements straight away. There is an inherent requirement required coming through. These are essential activities, capacities, and academic requirements that are necessary for students to successfully achieve those core learning outcomes. And you need to meet these inherent requirements in order to complete the course. So in the Doctor of Physiotherapy, they will include things like physical capabilities and behavioural capabilities, professional capabilities as well. We do make adjustments where we can. So if you perhaps have something that you think may preclude you from being a physiotherapist, it's worth reaching out and having a conversation. We definitely have people come through our physiotherapy degree with a variety of impairments that may be physically related or other related, and we can make adjustments for those, and we will support students where we can. And you can see there those categories: physical, cognition, communication, and behavioural, that need to be maintained throughout. That's a short summary of the Doctor of Physiotherapy. So I will stop sharing now, and I'm also happy to welcome any questions that come through.
Thank you so much. Fabulous. So as mentioned, if you do have any questions, we can pop those in the chat and we'll get to them at the end of the session. In the meantime, I would like to thank Hazel and Kelly for providing an amazing overview of these 2 degrees. We'll now open up the panel session and invite our speakers, Heber and Tim, to join us, who are current students. For our audience, please continue to send your questions through via the Q&A box at the bottom of your screen. But welcome, Heber and Tim, and thank you so much for your time and joining us this evening.
Thank you, Sienna. I appreciate it. Okay, so guys, when it came to my experience, and I'm going to be so bluntly honest with you guys, inspiration to go into the degree came from, I guess, the idea of wanting to have a conservative approach to managing musculoskeletal problems. And there is such a growing demand for this degree, and being in the course now, you see the growing demand. Like, for example, this Friday, we have a employment evening where they actually give us opportunities to develop even upon finishing this degree. What's also appealing is when you are a chiropractor, or when you choose to become a chiropractor, you're working in a clinical setting and your patients sort of become like family. And if that's the dynamic that you're looking forward, you're looking more into, then I would suggest it. In regards to the course, it was amazing. I'm in my 5th year now, and since year 1, if I look back at it, everyone I've known, whether it's professors or students, have tracked with us from year 1 till now. And it might not seem relevant, but they sort of become like family, and that can make your experience far better. Even if you ask Sienna or Tim, uni experience is a lot more, it should mean a lot more to you than you think. With the program and how it's structured. So from year 1, you are going through, you do have your manual classes, and that's the adjustments and technique classes that you learn from. And we gradually build up from there. And now in our 5th year, Dr. Hazel did mention that we are undergoing our clinical internship. So for me, I'm undertaking my internship in Summerhill. And how it works is we get to see our own patients at our own rate, but we do get supervision from our supervisors. And you have the autonomy to treat how you prefer. And it really prepares you for the following years to come. Before this year, we may have not been as prepared, but coming into it and coming to an end, you're building that big picture where you say, okay, it's making sense. I'm ready, or sort of ready. What also do I want to mention to you guys? The program is well structured. So it's well structured from day 1. And my advice for you is, if you do choose to carry on through it, or if you do choose to undertake the course, give it your full undivided attention. 5 years may seem like a lot, but they go by a lot quicker than you think they do. Give it your undivided attention. Focus on all your courses, because they are far more relevant than you think they are. And just enjoy the journey. And yeah, that's all for me. If you guys have any more questions, I'll happily answer them. And yeah.
Yeah, for sure. Thank you so much for that beautiful answer. And yes, keep your questions coming, because we do have a dedicated Q&A panel shortly. Tim, I'll pass over to you. Could you share with us what inspired you to choose your degree, and also share your student experience with us so far? Any highlights, things you've enjoyed, practical experience? What do you love about your course?
Yeah, for sure. Hello, everyone. So I'm Tim, and I'm in the 3rd year of the DPT. So the reason I got into physio was just I just wanted to get into a healthcare career, really. There are a lot of people that go into physio who were attracted to the sports physio side of it. Some other people have been patients of physios. neither one of those was true for me. I just wanted to get into healthcare, and I was sort of looking around. I was looking around at maybe like doctor or paramedic, but eventually I settled on physio. So yeah, I was always interested in the human body, health, and I think physio is really cool in that you're very involved with your patients. It's very it's a very personal sort of role you have. You're so directly involved with your patients. You might see them quite often. You get to like talk with them, sort of coach them towards the goals you've set. So yeah, I think it's just a very special sort of career. And so my experience with Macquarie, it's been great. It's been great to learn from some of our tutors, or all of our tutors, as well as with my peers as well. I like the mix of independent study that we have. So we have like online modules and things, as well as the learning and practicing that we do in class as well. There's also the Macquarie campus, which is great to study on with my colleagues as well. So I find that physio students are quite social. So there's a lot of informal study that we do, and sometimes we just hang out as well, like at U Bar or some other places around campus. We've definitely been known to just use a random spot on campus to practice our hands-on skills. So if you've seen us, like maybe I don't know, doing some shoulder test or something, that's probably us, or it might be the chiro students as well. Um, so a couple things that I've noticed in Macquarie in the Macquarie program is that we have a great mix of different sorts of students. So we have a pretty even mix of male and female students. We have people from all different ethnic, cultural backgrounds, a lot of different undergrads as well studying in our course. So I think that's great. It sort of adds to the richness of the student body here. And I think it's also great that we can utilize a lot of the skills from undergrad. So or even just in your daily life. So let's say if you have great communication skills, that's very valuable in physio. Or let's say you studied psychology in undergrad, that's very valuable to physio as well. And I think so. I think my favorite part of the degree has been the placements, just because it's the opportunity where you're like, you've learned all this theory, you have all this knowledge, and then finally you're putting it into practice and you see the beneficial effects that it's having on your patients. So it's great. And Macquarie has a lot of clinical placements. Some other places in Australia only have maybe as low as I think 700 hours, and Macquarie has 1,100 hours of placement in its program. So I think that's all I have.
Yeah, fabulous. Thank you so much, Tim. I think if you are someone in particular as well who's torn between either physio or chiro, I think the one thing that we can guarantee as students of Macquarie is that whatever degree you choose, there'll be lots of hands-on experience and opportunity to get practical outside of the classroom as well, which is something that we both love. So thank you both for sharing your experience. If I could get Hazel and Kelly to rejoin the chat, I do have a bit of a question for you. What are some important themes and trends within chiropractic and physiotherapy that would give our aspiring students some insight into their careers? Hazel, can we start with you?
Yeah, thanks, Sienna. So important themes that are occurring. So I think one of the biggest ones is that there's such an increase in chronic diseases in the population. So particularly with an old aging population, we're really seeing a lot of these chronic diseases increase. One of the biggest things that is shown to be really useful for nearly all chronic diseases, and here we're talking about anything from chronic pain, but also to heart disease, diabetes, arthritis, depression. One of the key things that seems to be really helpful for these patients is exercise and getting moving. And that can be really helpful. And so chiropractors are perfectly placed to really help get patients back to be able to move, be able to get back into normal activities or increase their activities, particularly with exercise, which then in turn will help to reduce weight and also just help with these chronic diseases. And so we can be there to help decrease pain, and that's often the reason why people can't get back into exercise, because it's just too painful. So we can help to reduce that to get them back. And others just need increased confidence and just need to feel confident in their bodies and their movement. And so we can help improve their function, get them stronger and fitter and get them back into that. So I think that's one really important thing that's really impacting practice. The other thing I'd say is that there's been a fairly big change in recent years that a lot of chiropractors now are really working into multidisciplinary environments. So, you know, probably 20 plus years ago, a lot of chiropractors worked either by themselves or within just pure chiropractic practices. Whereas now it's much more common for chiropractors to work into multidisciplinary centers with medical practitioners, physiotherapists, exercise physiologists, podiatrists, etc. And so really getting to integrate lots of different skill sets together. It's great for patients. They can go to one place and see different people, and the practitioners then will be working closely together. They'll know when to refer, when to collaborate with each other. And so I think that's a really positive step forward for all of these allied health professions and working together to help patients get as better as they can do. So yeah, I think those are probably the main things at the moment. And we really work into that with the Master of Chiropractic here to promote that collaboration. So at Macquarie University here, we're actually the only university in Australia that has a combination of chiropractic medicine and physiotherapy all in the one university, but also in the one faculty. And so we can use that to actually, you know, really promote cross-disciplinary activity. A lot of our students are in the same courses, the same units together, particularly in the undergraduate programs, but then that works through into the postgraduate programs as well. So it really helped to promote that further collaboration.
Yeah, for sure. I think what I was exactly saying before in terms of any course at Macquarie, there's such a focus on not only working with industry and getting you as a student current information, but also that cross-disciplinary integration into every course, which is fabulous. Kelly, I saw you nodding a lot there. What would you say to that question as well? What do you think some important themes and trends are within your field that would give our aspiring students some insight into their future careers?
Yeah, I don't want to double up on Hazel because we're sort of in a very similar boat, aren't we, Hazel? That physio is very much found in all areas and are working more and more in cross-disciplinary. So we're starting to see more specialisation in physio than we did when I came out quite a number of years ago. So we have specialisation pathways beyond graduation that you can do through the Australian Physiotherapy Association. So we've got sports and pain and paediatrics and a whole big variety there. And I drove past a clinic the other day and I saw physio, chiro, and a few others listed in the same location. And absolutely, when we do our business plans in third year, we encourage students to think about when they're writing a business plan, are they going to be working with other people and how are they going to make that particular business work? One of the things I will add about physio, and perhaps if you can all indulge me for a moment, I'll just give you my quick story on how I became a physio, which was in year 12. I was studying for the final exams and my back became really sore and my neck became sore, and it was just from study. And I went to a physio and I came out pain-free, and I was like, well, that's it. I'm going to treat every neck and back I can find in the world. And then I got to physio and I got to third year and I discovered there was pediatrics, and I thought, oh, well, I'm not touching a back now. I'm going to do peds. And I found myself in neonatal intensive care units and with little babies, treating them. And then I discovered we could work overseas, and suddenly I found myself working in aged care settings and all sorts of different places. And one of the most exciting things about physio is because we promote movement in so many different areas and so many different environments, you don't have to be locked into one thing your entire career. So I spent 15 years in pediatrics and absolutely loved it. And then over a few years has sort of morphed through women's health because I used to see a lot of mothers, and now I do this pelvic health. And it's been a really nice transition for me to be able to do lots of different things. So the thing I love about physio is there's so many areas that you can go into. And I think if you're thinking it's sort of feels a bit like one direction that gets you in there, I guarantee you that once students come in, they get hooked on something they didn't realize they could empower and impact patients in such a powerful way.
It's very common as well, I think, that you go in thinking that you have a really direct passion about one thing, but then in following that, you discover something else and go after that instead. So the sky really is the limit when it comes to studying at Macquarie and then moving on into whatever field you end up in that you may not even have known about before you even started. Thank you so much for your answers. That was fabulous. I do have a question back again for Tim and Heather. In terms of your career aspirations, this is something that our students are often very interested to know about in terms of whether you're following kind of the very stereotypical or idea of what most people think of when they're going into your degrees, or whether you're doing something completely different or you want to do something completely different. Tim, could you tell us a bit about what you plan to do after finishing your course?
Yeah, for sure. So yeah, just because there are so many different variety of like things you can do in physio, I think at my stage, I'm just kind of figuring out the basics of where I want to head to. I don't really have a plan yet of like, you know, this many years in the future, I'm going to be doing this kind of thing. But my initial plan is to work in a hospital. So when we graduate, there's a process where you get allocated to a hospital. So that's what I plan to do after graduating, and then I'll see how it goes. Maybe I'll end up in like a special area of the hospital. There were some of the areas already on placements that I kind of found interesting. So I think I'll just see how that goes. And but who knows? Maybe I'll have my own clinic one day.
Fabulous. How about you, Heather?
Look, now that we're close to the end, the path that I see myself going is into a clinical setting. But the thing that comes to me as an appeal is it's not just working in Sydney. I'm actually starting to look at maybe opportunities outside of Sydney. We're one of the best chiropractic, like we have one of the best chiropractic programs at Macquarie, and it's an evidence-based program. But when we compare it to countries overseas that don't even have this program, opportunities overseas are endless. So that's something that does come to me as an appeal. And it's the clinical setting, whether it's in Sydney, rural, overseas, like they're all things that like they're exciting. And yeah, something to consider.
Yeah, for sure. Fabulous. Well, I can definitely tell from our Q&A box that I'm looking at already that all of our viewers are quite interested in Tim and Heather, your journey through the courses. So we'll get onto those questions and move on to our Q&A panel. But thank you to our speakers for a very informative and inspirational discussion, really. We will now open up our Q&A session. So if I could ask all of our speakers to rejoin our panel, and to our audience, if you could please continue to put your Q&A, your questions into that box at the bottom of your screen, and we'll get to as many of them as we can. So first, I do have a question directly for our current students. What would you say that your placement hours are like? How does it kind of work day to day? What would you say that your hours, days a week commitment to each of those look like? Tim, we'll start with you.
Yeah, so the way we do it is we have blocks of placement. So we'll have blocks of like 5 weeks. Then as far as hours, I mean, it's just it's full time work. So really, it's probably no different than any other semester since we study full time as well. So whether you're studying or on placement, it's kind of the same amount of hours. But yeah, as far as exactly how many hours, it depends where your placement is. But generally, it's like a normal workday sort of hours, 5 days a week for 5 weeks.
Amazing. And how has your placement experience been? What's the commitment week to week, month to month, day to day?
Okay, so the cool thing is, okay, so when we finished fourth year, we were given the option to choose like preferred clinic, preferred shifts, preferred days. And how it is now is we have 3 days of placements, where you have 4 hour shifts and they're set hours. So for me, I'm in on Monday from 12 to 4, Thursday 4 to 8, and that's how it remains every single week from the beginning of the year till the end. And your requirements end with you, like the course ends or the clinic placement ends with you finishing your uni requirements, seeing a certain number of patients, ticking the criteria, whether it's your neurological screens, your x-ray reports, all of that come into play. But it's pretty standardized and it works really well with our uni program. Like, for example, most of our subjects this sem or this year finish by 12 o'clock, and then we move off to clinic and it works well.
Sure. So like the placement and outside experience out of the classroom is somewhat integrated into your course structure, if that makes sense. So your course is designed to fit around the placements. Is that what you mean?
Very, very well. Like we did not even struggle with D2, which worked on.
Amazing. And actually, Tim, while Heather was answering that question, we got a question for you specifically based on one of your previous answers. Just asking you to expand on the point about when you graduate that you progress to hospitals to work. Could you tell us a bit more about that?
Oh, yeah, right. Yeah. So that's just what I'm deciding to do. You don't have to work at a hospital by any means. There's a hospital system where, instead of having to apply to, this hospital and that one and that one and that one, there's just a process that makes easier where you go through the process, and then you get, put at one of the hospitals that you chose. So it's just an easier way to get hired at a hospital. But when you graduate, there are a ton of different options in the private area as well. So there's lots of private clinics that are like dying to hire new grad physios. You can get hired straight away in like a private pediatric clinic or a private aged care home or private sports physio. There's a lot of private options, and then there's the hospitals as well.
Fabulous. Thank you so much for clarifying. I'm sure that helped the person who was wondering quite a bit. Moving on, we do have some questions for our course directors specifically. I'll start off with you, Kelly. We have a question that I think is directed straight to you. What is the difference between physio and exercise physiology?
Yeah, that's a really good question. So often physios and exercise physiologists will work together. Physiotherapists will generally oversee kind of the broader progression of a person's goals and their rehabilitation and return to their movement and where they're heading. And often then the exercise physiologist then may work in conjunction to help provide some of that management in some of those settings as well. So they're definitely close together. Physios can do the things that the exercise physiologists can do as well, but they can also do some additional things within their scope of practice.
Fabulous. Thank you. And then in terms of, I think this is coming off our discussion in terms of trends for both industries. Regarding Australia having an aging population, what would both of you say that the estimated rate of demand is required to meet the supply of estimated for both health professions? So Hazel, I'll ask you, if you don't have this stat quite on hand, I know it's a bit specific, I'd maybe rephrase it to what would you say the demand is like for your graduates at the moment, and what do you expect it to be in future given the aging population?
Yeah, no, it's a good question. I don't have exact statistics on that, absolutely. But there is always going to be a growth in these areas of healthcare. So there's, as we said, there's a growing aging population. Back pain by itself is also one of the leading causes of disability worldwide, and that's only been increasing across the years. And so there's a real need for people to be able to seek support on when they're getting pain, and be able to seek strategies to help them manage it, and then to continue to manage it into the future. So there is always going to be a demand for these sorts of health professions. It's one of those things that can't easily be moved offline. That sort of physical contact is part of it, and that is really helpful for the patients. So look, chiropractic as a profession, there's about 4,000 or 5,000 chiropractors in Australia at the moment. And so that's only servicing a very small subset of the population. So there's always demand, particularly also in different areas. So there's actually only 3 or 4 chiropractic schools in Australia. Mainly in the main cities, so obviously Sydney, but also across in Victoria, Western Australia and Queensland. And so if you go outside of those cities, there is a huge demand for chiropractors, so particularly rurally, but even in your other more metropolitan cities that are outside those areas, because they just don't have the graduating chiropractors coming through them. So yeah, demand is not really, finding work is not really an issue coming out of the degree. There's a huge demand there.
For sure. And Kelly, would you have anything to add to that?
So look, we're exactly the same. I think the Australian Physiotherapy Association currently has about 35,000 members or something to that effect, and it's rapidly growing. In response to the Royal Commission into Aged Care, there's very strong recommendations of increasing physiotherapy presence across all aged care sectors. So that's in the home, in the hospitals, and in residential care facilities. The WHO for the last few years has had physiotherapy on its radar, that governments should be really putting physiotherapy in front and centre as part of rehabilitation and primary funding. So we have even some countries around the world. I was in a meeting with the CEO of World Physio the other week, who's getting phone calls from countries saying if they haven't got physiotherapy, they're being told by the World Health Organization that this is a space they need to fill. So it's not even just expanding with an aging population, it's expanding even through that middle-aged population. I think Hazel spoke beautifully to that with chronic and complex care. Not only are we seeing a rise in that, but we're also seeing the benefits of what us and chiros can do in this space, and that evidence is getting bigger and bigger and stronger and stronger. So not only have we got a demand increasing, but we're seeing an increasing scope as well.
For sure. And even adding to what Heather was saying earlier, that if you're a student as well and you know that the demand is not only growing at home, there's also a demand growing internationally as well. So you can, as a student and a graduate, fill that gap. Thank you both so much for those answers. We do have another question specifically for our current students, Tim and Heather. I was wondering what the course load was like on campus in terms of days on campus for both courses. Is it 5 days on campus, or is there some online learning combined with face-to-face learning for practicals and tutorials? Heather, what's your experience of kind of commitment week to week for your course been?
Okay, let's start with the most heavy on year for us, and Hazel, I'm sure you'd agree, would be our fourth year. Do you agree? Yes. It was intense. You're on campus 5 days a week, but it is split. So you have a lot of your lectures some lectures are online. Many of your chiro lectures are delivered face to face. And you are always present on campus because you have many of your practical classes, whether they be your radiology classes, your chiro classes, neuro classes, they're all face to face. None are delivered online. When it came to initial years, it was mainly like a 3-day, 4-day load, but it does require your undivided attention. And I really do mean that. So you cannot work full time. Perhaps you can juggle definitely working part time and doing the course. And that's what I did. And it worked well for me. But it just depends on the amount of energy you're willing to like give in. Coming into the 5th year now, even though we have placement, you still find the ability to work. They give you the opportunity, maybe like a few days less to work and to manage that work-life balance. But it does get hectic, and coming to an end, you want to give it your undivided attention because it's what you chose to do and you chose to do it for a reason. So give it all your energy, give it all your time, and do it well. That's what I'd say.
No, for sure. And Tim, how would you say your week-to-week commitment on campus or off campus has been?
Yeah, so for us, it depends a bit on which semester. But I would say on average across all semesters, if you're not on placement, it's usually around 3 days a week at uni in class, give or take a few days, of course. And then there is a mixture of online modules that we do, online lectures, and then we come to class and do the more of the practical sort of things and sort of practice like communicating and doing all the practical stuff that's necessary. So it's a nice mixture of online and in class. And then when you're on placement, when you're in your placement block, that's going to be 5 days, 5 days a week, so full-time work. And there are some little mini sort of placements sprinkled throughout the degree, but that'll just be maybe a few hours here or maybe a few hours there.
For sure. Thank you both so much. I think this would be a good opportunity as well to ask our course directors, just because this is a question that I often got as a student ambassador, whether your courses can be completed either full-time or part-time. Is this an option for either of your courses?
I'll go first. Sadly, no, at the moment we only have the full-time option. It's something that we are trying to explore. And the full-time option does mean, Tim spoke beautifully then, that particularly in the early years, you're on campus a lot when we're doing the really big, Tim will remember the big heavy clinical weeks and lots of practical tutorials. And as you move throughout the degree, there's more of that flip content, the online modules to prepare you for future learning while you're practicing as well. And we really spend a lot of time setting up our timetables so that students come on campus and they get to do things in a block. So we do try and free up days so that even if you want to try and do some part-time work, some of our postgrads have got families, mortgages, all sorts of things. So we do what we can to try and promote that flexibility through there. But yes, you've still got that mixture that needs to come in as well.
For sure. And Hazel, what's the case with your course?
Yep. So we do offer both full-time and part-time entry into the Master of Chiropractic, and you can choose where you're at. So it's really a matter of, you can actually choose how many units a semester you want to do. So full-time load is 4 units. You can do as little as 1 unit if you choose to. It will just obviously lengthen the degree program. And you do need to make sure that you come and speak to myself or one of other staff around arranging a suitable plan to make sure you do things in the right order, because there is a very particular order that you do need to do units in, because a lot of them follow on from one another. So if you are going to a part-time load, then that does need to be considered. Normally we'd have people who if they don't want to do the full-time load, they'll usually try to do between 2 to 3 units a semester. It'd be unusual to just be doing one. And so that they'll usually be taking, so rather than the 3 years, they'll usually take probably about 5 years to do that master's program if they're going down to that sort of load.
Amazing. Thank you. That's a very common question we get, so I thought it would just be good to include that one. Kelly, we have a very long question for you, so I'll read it out and we'll see how we go with it. This one is from Melita asking about physiotherapy. Is there any difference between applying for early entry and the standard application? As I understand, the applications are accepted or viewed in order of GPA. So does that mean that one may be either advantaged or disadvantaged? For instance, what if someone who applied for early entry has the highest GPA out of the group and meets the minimum requirements, but if they were to apply for the standard application process, wouldn't that mean they would be compared to a different group and therefore the GPA may not be the highest in the standard application process group and vice versa? If that's the case, could someone apply for early entry, and if not successful, then apply for the standard entry process?
That's a great question, Melita, and because that's so long, I pulled that up on the chat on the side of the screen. The answer to that question is that at the end of the day, it really doesn't matter. So what we do is when early entries are processed, we're really looking at, based on historical data and what we know. So the DPT has been around about 10 years now at Macquarie. We look at the historical data and we can really work out who those people are that are going to get through no matter what round they come through. What I say to people is if you don't get an early offer, we will usually contact you to say, the door hasn't closed. You're still with us. You just haven't got that early offer yet. And we're going to look at you when we put out for the subsequent rounds of offers. So it's really not a case of a door opens, a door closes with an application. You can apply at any time. We start going through that process, and your application might stay there, and it might just be that, within the second or the third round, that then we can give you an offer at that point.
Fabulous. Thank you. Melita, I hope that clarifies your question. Please let us know if you had any further things you're wondering. I do have a few more very specific questions for physio in particular. So Kelly, I'll direct these ones to you. This student who's asking anonymously has said that they've just completed their Bachelor of Human Science with a major in human movement last semester at Macquarie, and their GPA is 4.8. What would be the next steps if they wanted to take a career into physio?
Yeah, so I can answer this question 2 ways. I'll go with the general physio, and then I'll do the Cell Macquarie one if that works. So basically, look, there's always multitude of ways. There are undergraduate degrees out there. There are some 2 years masters, and there's some doctors of physiotherapy that are extended 3-year masters. And I always encourage people to explore the different options to see what would suit them. Because there's lots of different reasons that people might want to do things. And one of those great examples is part-time versus full-time opportunities. Any degree that you do within Australia will qualify you for physiotherapy through the Australian Health Practitioners Board. So it's not really a matter of if I go here, I'm not going to potentially be a physio. You will always be a physio. In terms of wanting to then move forward, if you wanted to come through Macquarie or through another degree, you could reach out to the admissions team that we have. So we have an FMHHS admissions teams, and you can start that process of application, and you can put forward all of the units that you've completed, and then they can be cross-checked to make sure that you meet the prerequisite requirements at that point, and they can let you know then if you can go into that competitive process.
Fabulous. Thank you. I do have a few more specific ones for you, Kelly. Someone asked generally, what is the difference between completing a normal master's, potentially I think maybe in an allied health field or something like that, compared to a doctor of physio? I think that being the key term.
Yeah, absolutely. That's a really common question. So they're different structures. So if you're thinking of, generally a master's is 2 years in physio and a doctor of physiotherapy is 3 years. Sydney Uni is currently phasing out their masters in a preference of a doctor of physiotherapy, but there are still some other standard 2-year masters around. So the first thing to do is to look at what makes up those degrees and to see if there's something within a degree that really sparks joy, perhaps, or makes you think, actually, this is going to set me up really well. So, for example, if you're really thinking, I want to keep that private practice, I would even argue in a public hospital system, it's useful. The Doctor of Physiotherapy always includes that leadership, advocacy, and business component that we often don't see in a standard master's. The other thing you get from an extended master's is you get that research component. And Hazel spoke a bit before about the research component as well in the chiropractic field. And so what that research component does is it gives you an extra set of skills to take out being a physio, but it also opens a lot more doors if you ever want to come back and do further higher degree research. So we have a lot of alumni that like to come back and do their master's or maybe their PhD. And often when they enter, they don't have to necessarily do some of those first years of those masters because they've already had that foundation and they get that recognised prior learning that's come through the Doctor of Physiotherapy. If I want to plug the Macquarie Doctor of Physio for a moment, we currently have, based on our recent data, 100% employment rate. We have about 60% of people going to private practice, about 35 to 40% are heading off into the public sector. So we get quite a mix. And so we have really high rates of student satisfaction, and lots of the students say they're really prepared to be physios once they go out into the profession.
Fabulous. Thank you so much. I think you even answered some more questions that we had in there, like why Macquarie compared to other unis, and you summed it up all perfectly. A question generally for both Hazel and Kelly. Are there any scholarships available for either of your courses to students, or would you have anything you'd recommend them looking into? Hazel?
Yes, so there's a couple of options. So we do occasionally, well, every year, we do have a few Commonwealth supported placements. They are only very few though, and they are awarded via academic merit. So they will go to the top performing students entering into the Master of Chiropractic, and that is handled by the universities. I don't believe you have to apply for those. I think that is sorted out by the university. In terms of other scholarships, the chiropractic associations do offer some student scholarships and some student funding. So that's the Australian Chiropractic Association, and there's also Chiropractic Australia. And so they can offer some funding for students. And there's a few different schemes that they offer that I'm aware of. So there's schemes which you have to apply through, you'll write an essay, why you need the funding and what chiropractic means to you and that sort of thing. They also have funding for students from sort of rural backgrounds and things like that. So there are a few opportunities through the associations.
Amazing, thank you. And Kelly, was there anything similar for our physio course?
Yeah, that's a really good question. And I tell you, when you talk about looking at different physio degrees, funding is definitely, and I'm sure Tim can attest to this, is something that you'd probably consider moving out. A lot of our students will max out their government support that they might have got through their undergraduate, usually around about second year. And that's often when, even though there's not a lot of time on campus, the content really ramps up. So students find it hard to really try and maintain a lot of that work-life balance with the university. We have some Commonwealth supported places as well. We are currently in the process of really wanting to explore further opportunities to support people, like Hazel spoke about, rural, remote, people from Aboriginal and Torres Strait Islander backgrounds, and also looking at low socioeconomic backgrounds as well. It's something we're exploring. I wish it was something I could say I confidently had at this moment. I'll continue to advocate, but yeah, I think finances are a really big consideration that you should look at.
Amazing. Thank you both to you so much, and for all of our panelists. With that last question, that is the last one we have time for this evening, and we've now come to the end of the session. Thank you for everyone joining us in the audience this evening, and thank you to all of our amazing speakers. You may have already received an invite to our next event, which is our Discover Postgrad event. You could register for a series of live Zoom sessions in October, which showcases experts across various fields such as medicine, chiropractic, psychology, security studies, business, and more. You can book a one-on-one personal consultation with us and access an extensive library of on-demand videos. The link goto.mq/DPG is already in the chat box, and you can check that one out for more information. We'll be also sending you an email with further option to book a one-on-one consultation with our expert advisors, along with a recording of this session. In the meantime, if we didn't quite get a chance to answer your burning questions tonight and you would still like an answer, please email those questions to us at postgraduate@nq.edu.au. We look forward to welcoming you to Macquarie University soon. Take care, everyone, and thank you so much to our speakers again tonight.